Hello, this is Brian Casey of the Imaging Wire. We are here at RSNA 2025, and we are here in the booth of Lunit. We have with us Brandon Suh and Craig Hadfield of the company. Gentlemen, thanks very much for being with us.
Thank you.
Thank you very much.
So, Brandon, you're the chief executive of the company, and you guys have had a lot of changes in the last year or so, a lot of new developments. Can you give us a little bit of an overview of what Lunit does, and also what some of your recent milestones in the year have been?
Yeah, thank you. So Lunit is our mission is to conquer cancer through AI. We were founded in 2013, one of the first generation medical AI companies here. We've grown quite a bit. We went public in 2022, so we're actually one of the very few public companies in this space from a startup company perspective. So for cancer, what we do is we have two business units. One business unit is focusing on the cancer screening line. So we apply our AI in the screening modalities like chest X-ray, mammography, etc., to enable more earlier diagnosis and more efficient diagnosis of cancer. The second thing is we develop biomarkers for oncology. So for cancer patients, we predict response to treatment and work with pharma companies and apply it in their clinical trials and stuff like that. So that's more on ASCO and other. Here we're more focused on the cancer screening side. Last year we acquired Volpara, was represented by Craig, where we combine our AI image detection capabilities with Volpara's breast ecosystem, where they have various products that are integral part of the breast cancer screening workflow and process. And so we have that integration going on right now, where we're combining forces. So this year was the first year where we combined our brand together, and then we continue to. This year, we started to integrate our companies together to work together, especially for the U.S. market, where we have Volpara's strength is more. And so that's what we're doing, and then I'll pass it on to Craig for more detail on what we're doing in RSNA.
Yeah, thanks, Brandon. So I think obviously the core focus for us at RSNA is on the diagnostic imaging side of the business, which is really a lot of the Volpara products originally, and obviously now under the Lunit branding, together with Lunit's AI products. What that really gives us is an ecosystem that really spans the entire mammography pathway for a woman. There is the chest X-ray part of the business as well. Our core focus on the US market, at least for the moment, is really in mammography. So we really focus on the ecosystem, whereby we can cover every single aspect of the mammogram from a software perspective. What do I mean by that? We have a patient tracking tool, which helps with compliance and really the back-end functionality of a mammography department. We also then have a product right up front that helps with technologists. So really giving a point of care feedback to the technologist about how well she's doing her job. And that feeds into our product called Analytics, which has really been our flagship product for a number of years, which gives a lot of quality feedback around every single image that is taken at a healthcare organization. And that's from a positioning perspective, a quality perspective, dose and compression as well. And that really helps organizations, one, with the technologist shortage and making sure that their quality is really good, but two, allowing each individual technologist to see how they're tracking. Are they improving? What areas can they focus on? So that's one core area. We also then have Risk Pathways, which for us has been a very successful product. We acquired CRA Health about 5 years ago, which was the Risk Pathways product, and we've seen tremendous growth there. And that product really helps healthcare organizations triage women based on their risk profile, using patient history, Volpara breast density, which is the only commercially approved input into the Tyracusa gait model. As well as genetic information as well. So we're still seeing a lot of growth in that area of the business. And then obviously part of the reason for the acquisition was Lunit, and we weren't first to the market with AI in the market in the US, but we've started to make significant traction over 2025. We have a very strong pipeline, and the booth has been extremely busy the last couple of days. Everyone is interested in AI, and everyone is interested in some of the things we're going to talk about in terms of what we're looking at for the future.
All right, perfect. Brandon, can you give us a little bit of a roadmap or an idea of what we can expect from Lunit in 2026?
Yeah, so we will continue to push through and expand commercially, especially through the combination of the forces between Lunit and Volpara, now branded together as Lunit. Very important. We also are looking for further innovations using and taking advantage of the full power of AI. And one of the things that we're offering the market starting this year, actually, and then moving forward for next year is we call it foundation model services, where we are developing. There's the same thing in terms of we're focusing on chest and breast, but then applying foundation models. So it's similar in terms of the AI, but the background technology is more advanced. The benefit of that is what we do is, and one of the things that we have noticed is that when we develop AI and we apply it to customers, based on the customer side, sometimes you see variation in accuracy level of the AI because the training data, it could be quite different from the actual data on each site, and you have their variation, whether it be devices, whether it be population, whether it be the image processing that is being used locally, etc. So the foundation model, what it does is it customizes, so it gets a small amount of data from each site, and then we customize it and deliver customized AI models to each site, which benefits from a accuracy perspective, and we also can customize specific features for some of the needs and then we could allow customers to actually develop their own AI using our platform in their own needs. So that's something that I think a lot of people are talking about in this event particularly. I think it's something new. Sure, yeah. We're still trying to, so we do have an announcement we made a few days ago with Simon Med, where we're actually doing a pilot regarding foundation model services with them. So we're trying to expand that further, and we'll see how that goes. So that's one important milestone that we're trying to achieve.
All right, very good. Well, it'll be great to watch you guys progress next year. Well, Brendan Suh and Craig Hadfield, thanks so much for being with us.
Thank you. Thank you.
Thank you very much.
Signing off from RSNA 2025, my name is Brian Casey of the Imaging Wire.